Hi, Ash. It's Stephanie and Adrian Vendetti from the How to Be a Redhead podcast. How are you doing?
Hi, thank you for having me.
Yeah.
I'm doing great.
We're
Awesome.
so excited to talk with you all about teeth, dental hygienists, hairstyles. But before we go into all of that, a question we like to ask our guests who are natural redheads. What was it like for you growing up with red hair?
It was sometimes a challenge. I got called all the classic carrot top, all those classic, little names that kids like to call each other. But I think the biggest thing is I'm wearing green because my mom didn't want me to wear green. She's a redhead. So she
She
felt
didn't
like
want you to wear it.
she didn't want me to wear it. She said something about a Christmas tree, and I think it made me go, okay, my favorite color is green. So, yeah, that's my biggest thing. And but I remember in elementary school, it was definitely the worst, being teased by kids and stuff. But
Yeah.
everybody gets teased somehow or another.
And I always love to ask a redhead too, because when younger redheads write into us, we always say there's a time in your life where it switches, where like all of a sudden now it's like not only cool to be a redhead, but people are now admiring you for having red hair. So when do you think that switched for you?
Yes, so in high school and college is kind of when that changed for me. It also kind of made a difference too when weird men would come up and like touch my hair and stuff like that. Has that ever happened to you guys?
Oh yeah. Oh yeah. Strangers always coming up and touching our hair. I don't know why they think that's appropriate, but
It's
I
not.
I've never liked it. I don't like being touched anyway. Never mind a
Yeah,
stranger coming and touching my hair.
Yeah, it's a
right.
weird thing that redheads experience, I think, and don't really know why it happens or how someone feels inclined, why they feel inclined to touch our hair. It's very strange.
And creepy.
Yeah, it is. It is. And you mentioned that your mom has red hair
Uh-huh.
and you have three boys. Do they
Yes.
have red hair?
Yes, my oldest has
Oh,
red hair. So
nice. That's
it was so
awesome.
funny when he
That's so
was
nice.
born. He had like that. I can't remember what the name of the hair is, but there's that hair that they're born with. And it
Yeah.
reminded me a little bit of orangutan. It was funny. It wasn't like super strong and potent, but like if you really looked at his skin, it was like pretty and red. And then that's how I knew he would be a redhead. Because when he first came out, it was like a strawberry blondish kind of look.
And it can
Um,
change.
and
Yeah.
it can change,
Mm-hmm.
but he's very vibrant red. So
That's
Wow.
yeah,
awesome. And
yeah,
how old is he? Does he like his red
he's
hair?
13.
Okay. So what does he
Yeah,
That can be
experience
that
at?
can be a tough age, yeah.
yes. So, well, he talked to me about the other day about how he worries about what he wears, and he wears a hat a lot. So I don't
Mm,
know if that has something to do with it. I don't know.
mm,
He's not super vocal about if he gets teased or anything like that about his hair, because I've asked
yeah.
him. But anyway, I'm hoping it's better for him.
Yeah, I know.
Yeah. My husband kind of has the same story. He said that he wore a hat a lot and, when he had like really, really vibrant red hair. And then as it like got, red hair changes. So by the time he was like in his mid-20s, it was different. But I think a lot of people want to cover up, especially redhead men. It's easier to just cover up and wear a hat than to have to be worrying about being
True.
teased. I think that
Yeah.
that's something
Right.
that they go through. And I think that's totally normal. But yeah, it's just a path that redheads have to take to self-accept themselves.
Mm-hmm.
Right. Right.
Yeah.
Yeah.
Yep.
Yeah.
I know. And you have two Instagram pages. One is Spitfire Hairstyles, and then the other one is Redhead.RDH. And we'll
Correct.
put those in the podcast notes so our listeners can start following you. But how did you start your pages and how do you balance work, family, and then also the content and everything that goes into the social pages that you have?
So I've always done hairstyles because I have three boys. So I don't
Oh.
have any girls to do hair with. And when I was little and with my best friend, we would play salon all the time, which is funny. You'd think I'd be a hairstylist, but I don't. I just haven't become a hairstylist. But anyway, so I decided that I would start a hairstyle page, but I wanted it to start to eventually be my dental hygiene page because my goal is to eventually have some kind of a business to go from that.
Mm.
And so I started posting most of my hairstyles to kind of set me away too from other dental hygienists that have their pages. As far as I know, there's no other dental hygienist that I've come across yet that does scrub life hairstyles. So that's what I call them. So people also know that when they join my page, they're going to see scrub life hairstyles, not just
Yeah.
dental content. So,
Mm-hmm.
and then I just noticed that a lot of people liked my hairstyles. So I started the Spitfire hairstyles after, I think, 8 months of doing the Redhead RDH page. So,
Mm.
yeah.
That's so cool. That's
So
so
it's really
cool.
fun.
And dental and redheads kind of go hand in hand. Our audience is so into
Mm-hmm.
talking about how it is for them and their experiences when they're getting their teeth cleaned or in the dental chair getting whatever they may be getting. And Stephanie and I are big dentist people. We've had so many dentists on the podcast in the previous seasons because not only are we passionate about our teeth, we get cleanings all the time, but we know that redheads really do suffer from pain management when they are at the dentist. So before we get into all of that, we're interested to know how you became a dental hygienist. And fun fact, before you came on, we were talking about how dental hygienists are really good at conversating when we're not able to talk. So we just wanted to add some humor to the question, but how did you become a dental hygienist and do you have a gift for gab?
Yes. So after high school, I had a role model that encouraged me to become a dental assistant. And one of our programs that are local is through a local dental office called Assist to Succeed. And so I did their dental assisting program. And then I started doing my internship and eventually became a dental hygienist for that office, or a dental hygiene assistant, I should say, for that office. And then, so I did dental assisting and dental hygiene assisting for a year. And I worked closely with the hygienist mostly. And that was really the cornerstone of my passion for dental hygiene. Started there because I learned a lot from her, and I just really loved how the patients, they always said, "You're so gentle and you always do such a great job. You're very thorough, all these things. I love coming to you." So it made me, because I heard that more than, "I don't want to be here. I hate seeing the dentist." And so I think that just had a positive impact on my life. And I just told myself after that, I didn't really want to stick with dental assisting. If I'm going to be a mother, that's more of like an 8 to 5 kind of a job. And I wanted something that could be more flexible. And with dental hygiene, you can be more flexible. You can work 1 or 2 days a week. You can work 1 or 2 times a month, depending on the office that you find. So it can be more flexible with being a mother.
Yeah. And I
That's
didn't
great.
realize that they have travel dental hygienists.
They do.
Yeah,
They
which is
do.
like
Some
traveling
corporate
nurses. Yeah.
Mm-hmm.
Yeah. And then going into redheads feeling more pain, as Adrian mentioned, we've had numerous dentists on past seasons and they've shared their expert advice. But for our listeners who may not know, numerous dentists have confirmed with us and studies that redheads do feel more pain at the dentist. This is due to Novocaine wearing off faster. So have you experienced this yourself? In terms of not personal, more on a professional standpoint.
Okay, good. Because I was going to say I don't have much experience except in hygiene school for getting
Yeah.
them.
Yeah. No, but have you seen it as, with the patient who is a redhead?
Yes, I've seen it a couple times. For me, the numbing stays on for a while.
Mm.
So that's helpful. But for some other redheads, yes, it can. So we just try to boost them before that
Oh.
wears off. If that
You
Okay.
makes
do.
You boost them with more Novocaine,
sense.
knowing the time on when it's about to wear off.
Yeah.
Okay.
So what what I mean by that is we do the initial numbing, and then we will sometimes give them a little bit more.
Oh,
Or there's
okay.
also a longer lasting anesthetic called Marcaine
Okay.
that lasts a little bit longer. So that's also a
Mm.
good option. As a redhead, you could ask possibly for Marcaine or whatever they have in their office that's a longer lasting anesthetic. So that's one thing that I would recommend. And then another thing is just asking, can you boost me, maybe
Yeah.
whatever minutes into the procedure, depending on how much dental work they're getting done.
Oh, that's
So,
a good tip.
Wow.
Like, give
Yeah,
me a
no, that's
boost.
good. Give me, give me, give me a little boost. I was wondering too, I think it's becoming more mainstream and more talked about that redheads do experience more pain. And so we will need more Novocaine. But have you ever experienced someone, like maybe a doctor or a fellow coworker who maybe doesn't even know about this? Like, is this a common thing to say in the office? Okay, a redhead's coming in. She's going to need,
Mm.
she or he or whoever is going to need more
I didn't
Novocaine,
know about it.
or you didn't know about
So you
it?
I
don't
didn't
learn.
know about it
Oh,
till I
okay.
became a dental hygienist. So,
Okay.
yeah. Yeah.
Okay, so you did you learn about that in school, or you learned about it when you
I
were
learned about
working?
it after, mostly
You
after.
did.
Uh-huh.
Okay.
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 Yeah.
And how long have you known about it? Has it been like many years or not that long?
So I've been practicing. I'm going into my 5th year. So I'm 4 years in and I'm going into my 5th.
Okay.
Okay.
So it's pretty
So,
recent you were in
uh-huh.
school. Yeah.
Yeah, honestly, I learned more about it when I created my Instagram page last January.
Oh, so cool. And then people have been telling you and you're like,
Yeah,
"Oh, wow. This is
yeah.
really true. This is really true." And what
Because I
about
think a
you
lot
as a
of
redhead?
offices too just think it's a myth. A lot of the
Yeah.
offices I think sometimes think it's like, we're babies.
Right, right. Yeah, they
which
think that we're being
which I think
dramatic.
is
Yeah.
why which I think is why a lot of redheads have that fear, that
Yeah.
they're like, oh, it's just in your head.
Yeah, it makes me think of after I had my son. He was my first. I have two kids, but I had a C-section, and I ended up having some bleeding after. And I remember my OB, they had a pay chart, and then she came into the room and she goes, "I knew you were going to be difficult being a redhead." And I said, "What do you mean by that?" And she goes, "Redheads bleed more." And then fast forward to then I had my daughter last year, and I mentioned it to another OB in the office. Oh, so and so doctor who's now retired in their old practice mentioned it. And she goes, that's not proven. So I thought that was interesting how both in the same
Yeah.
practice, my doctor, who was a little bit older, and I thought that was interesting, said about the bleeding more, ended up retiring. The young doctor that I had, she like wanted to debunk the myth. And
Yep.
I just thought that it made me think of how we're talking about dentists, how one dentist thinks, yes, redheads need more Novocaine. Another dentist may say, no, that's a myth. So it seems to be
Steph,
that.
the same thing. The same thing happened to me. When I was getting anesthesia, I asked, "Oh,
Do redheads need more anesthesia? Because science studies show that you need about 20% more, is what they're saying for
yeah,"
a redhead.
and the anesthesiologist said, "Yes, you do need more." And then when I asked another anesthesiologist that, Steph, last year with Dad, they were like, "No, that's not
Yeah.
true." So it's really crazy.
Yeah.
I think it really depends on what they know and their knowledge of it. And,
Yeah.
there are like so many proven facts, and we've had scientists and doctors on who have confirmed all of these
Yeah.
things.
Maybe
So
it's some
I think it's
doctors
just going to
just,
take time.
maybe some doctors just think, okay, we're all human. And then like the hair is just like these studies
Doesn't
that
matter.
people want to put in the mainstream. And yeah, it doesn't matter. So do you agree, Ash? Like, what's your
Yeah,
take?
yeah. I also think experience goes a long way. Like, what is their experience with
Mm,
other redheads in the past?
true.
And then
Okay.
if they get some redheads that probably do really, really well at taking care of their teeth, and they don't bleed much, like the one that said redheads are bleed more. Like, some of us will see redheads that have healthy mouths, and some others might see more redheads with, things that go on more, But outside of the dental office with my boys, I had C-sections. So they did give me more general anesthesia for that.
Yeah. Okay.
Really?
I'm
Because
wondering if, yeah,
yeah.
I'm wondering if mine, I don't remember. I mean, I didn't ask, but
Do you have a C-section?
I had a C-section with my son, and then I ended up having a VBAC.
Okay.
But yeah, I never asked about the anesthesia. I think, you're thinking about so many other things that it wasn't like, do I need more? But I should have
Right.
asked, because I remember her. She was an awesome anesthesiologist. So yeah, it's just it's so interesting how, I don't know, maybe it will change and it will become more mainstream to see a redhead and a doctor's like, okay, yes, they need more
Right.
Yeah.
Novocaine.
And I think too, this is like we talked to a doctor from Cleveland Clinic, and he does mostly skin, but he said a really important thing that all doctors should be asking across is like, are you a natural redhead? Because of course it's such
Right.
there's so many people who dye their hair red, but
Mm-hmm.
to really find out about if they're going to have to change up anything in their routine, it's if they're natural. And some people look natural and they're not. So I
Right.
think it's really
And
important for doctors to do that.
And that makes me also think of, we have a lot of people who write into us saying, I don't know if I'm a redhead. Here's a picture of my hair. Adrian, how many DMs do we get like that? And we're not ones to say, yes, you are. So we just share an article that we have on our website that kind of helps guide you with like different colors, even though it's a beautiful thing that all redheads, it's like a fingerprint where every shade is so unique. But we just give them that website link as a guide, that article link. But it's interesting. So a lot of people might be sitting in a chair and then not even knowing, okay, am I a blonde or a strawberry blonde? Does that signify as a redhead? So maybe that's what a doctor's thinking
Right.
too. I don't know. It is
Right.
fascinating if you really break it down like we're doing.
Right. And one more tip too about the anesthetic. So you want to have less vitamin C before your appointment,
Okay.
because it's going to interfere with how effective the anesthetic will be for you.
Did not
Because
know that.
typically,
Okay.
after what we recommend in our office is after your dental procedure, take some vitamin C rich like drinks or foods to help the anesthetic wear off faster, because it kicks your immune system and boosts your immune system to kind of get that going, and get that to wear off faster. So if somebody comes in and they're a redhead and they also have had a lot of orange juice or something before their appointment, because that's a common one for breakfast,
Yeah.
that can hinder how effective the anesthetic can be.
Oh, what a good
Oh,
tip.
wow.
And then
That's a really good tip.
yeah, and what's your tip for those who are afraid of the dentist? They just don't like going and
Or they won't go.
won't go.
Oh, that's a good one, because for everybody, it's different on their trigger. So when somebody comes into my office, I try to find out, they'll list that they have anxiety on their health history. So that's a great way for me to know, okay, this person might have some dental anxiety. So when they come in, I ask them when I'm going through their health history, do you have dental anxiety today for your appointment? And if they say yes, then I just try to find out, is there any way that I can help make this more comfortable for you? Are there any triggers that make this worse for you? And a lot of times people like to just be strong and shrug it off. But I feel like the number one tip, though, that can help is just telling them what you're going to do next and trying to be as, more on the compassionate side than being super blunt and abrasive, if that makes sense.
Yeah, definitely.
Redheads, have you heard?
We aired on ABC's Shark Tank, episode 14, season 15. We are busy developing products and continuing to grow this incredible redhead lifestyle brand.
Check out our mascara and eyebrow products in red hot shades, hair care merch, lifestyle items, and so much more. Redheads, we can now rejoice.
Finally, there are products for us.
Use code podcast to get 15% off your next purchase. Shop at shop.howtobearedhead.com.
And how about teeth whitening? Do you have any tips for redheads, maybe with sensitive teeth, gums? I know I have some sensitivity with my gums. My dentist was saying it's because of years when I was younger with braces, and then now like it's catching up with me that I'm getting, but the toothpaste I use is for sensitive gums and I feel like it helps, but I'm not super sensitive when I use like Crest white strips. So what are your whitening tips for those that are listening with sensitive teeth and maybe without?
So I have really sensitive teeth, so
Oh,
I
you
guess
do? Okay.
this is a good question
Yeah.
that I feel like I can answer. So there is prescription toothpaste that you can take,
Oh, okay.
or
Okay.
you come in, and what it is and what makes that toothpaste different than other toothpaste is it has a higher concentration of fluoride in it. So that fluoride is what's going to be effective to help against sensitivity, to fight against sensitivity, because it kind of, depending on the fluoride that's in the toothpaste, it will either coat the tooth and kind of put like this barrier over it. And you can use this toothpaste a couple weeks before you do your whitening.
Oh, okay.
Or it's going to block the dental tubules in the enamel that have access to the nerve. And so sometimes some of the toothpaste will go in there and just kind of block those little tubules. So there's also, if you don't want to do a prescription toothpaste, you can do rapid Sensodyne. I wouldn't just do Sensodyne, I'd do rapid because it's
What is
supposed to work
that?
quicker. It's supposed to work quicker. So the normal
Oh.
Sensodyne works between 2 to 4 weeks if you use it daily.
Okay.
Sensodyne toothpaste.
Uh-huh.
Oh, yeah, I use Sensodyne
Rapid.
toothpaste. Oh, Sensodyne Rapid. Okay, okay.
I'm not sure if it's Sensodyne Rapid or if it's Rapid Sensodyne, but anyway, as long as it says Rapid, it's supposed to work within a week.
Oh,
if you use it
okay.
morning and night.
Okay.
Yeah. So that's
Good
a
to-
really quick, easy fix. So they can try that first. And if they still have sensitivity, then I would go to the prescription toothpaste.
Okay.
There is another toothpaste called MI1 paste, and you can get it at Walmart. It is a little bit more expensive though, and it is a smaller tube.
Okay. And I'm
But that one's
wondering
a good one.
I'm wondering your professional opinion on fluoride-free toothpaste.
Yes. So hydroxyapatite is the ingredient that I recommend, and I'm actually starting to fall more in love with because it uses the natural components of the tooth to help build the tooth up and remineralize the tooth.
So is
So
that
it's
an
really cool.
ingredient in a natural toothpaste?
It's not always. You have to look for it.
What's it called?
So hydroxyapatite.
Hydroxyapatite. Okay. Okay.
And most commonly you'll see in other toothpaste that don't have hydroxyapatite, they'll have some other kind of anti-cavity ingredient that, for example, xylitol. Xylitol is a great anti-cavity ingredient, but
Okay.
I feel like it's not, in my professional opinion, I feel like it does better with something else like hydroxyapatite or fluoride.
Okay.
But hydroxyapatite is awesome because it's just a great one that I even recommend to my patients that have fluoride and don't have a problem with fluoride. So,
okay. Okay. That's a
yeah.
really great tip. And I know, being a mom of 3 boys, what do you recommend? Like, do your boys use the same toothpaste that you do? I know that it's different. I don't know how young your youngest is, but like my daughter, she's on like that training toothpaste that is fluoride free because she obviously doesn't spit. So,
Yeah.
and spitting, I didn't realize takes like a special technique, like blowing your nose. It's not, it's something that we as humans need to like, we take for granted, because I'm teaching my 3-year-old son right now, side note, how to like blow his nose. And it's like a big ordeal. And
It is.
yeah, but with spitting,
Yep.
I'm like, spit your toothpaste out. And he sucks it in. He swallows it. Like, so what do you recommend if listeners are like, oh my gosh, I don't know what to use for my kids? I think that that's something that I've Googled before in the past because I just didn't know myself.
So, as a dental hygienist mom, I guess I go according to what my kids preferences are,
Okay.
because it's hard, because you don't want to have a kid use a toothpaste that they're going to hate using.
Are you talking about the
So,
flavor? Like
mostly
strawberry bubble
the
gum?
flavor.
Yeah.
And then some toothpaste you can get that are less foamy than others, so that can make a difference. So honestly, I have one child that uses Crest toothpaste, but he likes the fruity kind. And
Okay.
then my oldest, he actually is using the prescription fluoride toothpaste because he's in braces right now. So I'm trying to make it so he doesn't get cavities.
Okay.
Yeah.
And then my middle one, or my youngest, excuse me, he actually just uses mint, and he uses the Colgate samples.
Okay.
So I honestly, I just have my kids just try out the ones that they like, but I know that that's not always feasible for parents. So for advice for parents is I just recommend that if they're not going to like minty, then get a fruity kind, and maybe go to the store and let them pick out what kind of toothpaste they want. And that usually brings more success in some kids that don't do well with brushing.
Yeah.
And I love that you would use a fluoride-free one until they can spit out. That is perfect. I think
Oh,
that's
good. Yeah. I know I made the mistake. Well, my son, I was like, pick out a toothbrush. And he, of course, wanted like a Paw Patrol one or something. And then he ended up wanting one that was like 10 times the price as like a standard, a normal one. But yeah, I haven't gotten him an electric toothbrush yet. My dentist recommended have him get used to actually brushing before relying on like an electric. But I will say, once you go electric, you never go back to like stand. Yeah.
So true.
Right.
You get that. It's cleaner. It feels cleaner.
Yeah.
He's probably thinking to have them learn that dexterity, because
Yeah.
if they go to an electric toothbrush too soon, sometimes they don't learn that. But at the same time, it's like, oh well,
They're
an electric toothbrush, if they're not going to have the dexterity, then sometimes it's nice because they just kind of go like this, like they're supposed to.
yeah.
You
Yeah.
know,
And
you're
then
not
you're
supposed
like,
to scrub with an electric toothbrush.
right. And yeah, he's at the age where I fight him not fight, but like
It
it's a
feels like a
battle.
fight.
It's a battle. It feels like a fight. It's a battle to brush his teeth. I have to.
Yeah.
Yeah. Yeah, I know. It's like teeth are so important though. Teeth are like, yeah.
Well, I came across like this fact, actually, my husband sent it to me the other day, that the only brushing your teeth is the only thing we do to take care of our skeleton, like physically, like outwardly.
Oh.
And I thought that was interesting. Like, yeah, that's true. That's the only thing that's like exposed that doesn't have like any flesh or arteries or anything around it. You know,
That's so true.
it's inside it. And yeah.
Yeah, no, this is all really helpful because I talked to my dental hygienist last time I got my teeth cleaned a couple months ago, and she was just informing me that you wouldn't believe the amount of people who come in who either don't brush their teeth twice a day or they're in their 40s or 50s, she was saying, and they're getting their teeth cleaned for the very first time. So Adrian and I take for granted that we grew up with parents that really, really, they take care of their teeth. They floss every day. We got similar to you, Ash, with your kids are brushing their teeth, but that's not the case for everyone, as I'm sure
that's crazy to me.
Yeah.
What's really funny is I didn't grow up going to the dentist very much, and I'm a dental hygienist, so that's kind of interesting.
Yeah.
And that's partly, I think, the reason why maybe I didn't have many experiences with being a redhead per se, with going into the dental office. So, and then that's why my first time getting numb was at school.
Wow. Okay. Yeah. So everyone's story, I know. I was just
It's so different.
Yeah, everyone's upbringing is so different and their background with their teeth. So my dental hygienist was saying she has to treat every patient as if like she has to think like she goes through like, okay, I'm using this tool right now. Now that she knows me, she knows that I've been with her. But if she was saying if you're the first time that you're sitting in her chair, she treats you as if this is your first time getting your teeth cleaned, because that's the case for some people.
Yep.
Yeah.
Yeah, I will get still, I can name at least 5 patients that I've seen in my career so far that say that they don't brush or floss. And it's because, and I ask them, well, how did it go growing up? Did you brush,
Yeah.
floss growing up? And they said no.
Okay.
And so I think, in my opinion, I think if the kids miss that critical learning stage, they will have a harder time as an adult
Yeah, I agree.
surpassing that if they don't learn those certain skills and habits at that certain critical age.
Yeah.
So, yeah, and I just tell them, it's progress over perfection. So just let's make some achievable goals that you think you can do now. And then I
Yeah.
want you to take it month by month and work up. So
Yeah.
hopefully by the time you see me, you're brushing daily and you're flossing daily.
Yep. And then it becomes a habit. So yeah, definitely. Definitely.
That's so true. So before we go, Ash, because we've loved talking to you about all this exciting stuff. As you can tell, we are very passionate about dental stuff.
I love
Is
that.
there, thanks. I love that you are giving inspiration to so many people in scrubs to rock
I
great
know.
hairstyles, and we talked to many hairstylists throughout the podcast, and I always feel like hair gives that confidence boost to everyone. Like when your hair looks good, you feel good. That's like when my hair's clean or when I go to the salon, I feel so good. And so I think you are giving a lot of people, specifically who are in scrubs, inspiration to not just
And
put it in a
confidence.
ponytail or whatever gives them, and just give them a boost of confidence to have their hair in a pretty style to give them something different that day and some kind of boost that day, because days you don't want days to go into days and then it all feels the same. You want it to feel special that day. So for anyone who's writing in or listening in and they are in scrubs and they're getting inspiration from you for hairstyles, is there one hair product that you carry on you all the time that makes you feel good throughout your day working as a dental hygienist?
So I carry a scrunchie or a ponytail holder fastener.
Okay.
That's always something I have with me. Yeah.
That's great. That's great. And I see you have some
Thank
products.
you for that compliment. I haven't heard that one yet. So that makes me feel really nice inside.
Oh, no, pleasure.
It's
Pleasure,
so
of
true.
course.
It's so true. It's so nice to just, do your hair in the morning. And also, I'm sure, like, if you do your hair and you're in scrubs and you're with a patient, it's nice to hear a compliment. Oh my gosh, I love your hair. How did you do it? Do you get compliments like that when you? Yeah,
I do.
that's
I do.
great.
So it makes it a fun little segue. Because you
Yeah.
mentioned talking to patients and conversing with them, which I forgot to cover, but it's a nice segue to sometimes get into complimenting them. And the conversing, I just try to talk to them when I'm past, in my transitions.
Yeah, right.
Because I'm more of where I am more shy, I feel like, and talking can kind of be uncomfortable. So I just ask my questions when I'm transitioning to an instrument, and then or rinsing them, and that kind of helps a lot.
Yeah,
that's so cool. That's so cool. Yeah. And I see you have some products. Did you?
Oh yes, sorry.
Is this a brand that you love?
Yes. So let me see if I can. So Mazzani is what I use.
Oh,
okay.
But I am trying to get money to buy one of your boxes. I think that would be so fun.
We'll send you products, of course.
So this is Mazzani. It's a press agent, and this is the shampoo and conditioner. So it's supposed to help protect your hair against heat, and I use kind of a lot of heat. I am trying to go more into heatless stuff, but that just takes preparation at night, and I'm ready to go to bed.
Yeah, after having 3 boys and working, I don't blame you. I would just want to crash on the couch. You mean heatless hairstyles?
Heatless curlers, yes.
Okay.
Yes. So I use a lot of heat to style my hair. if
Mm-hmm.
that helps
Mm-hmm.
with clarification.
Yep.
And then after I wash my hair, I use the Mazzani Press Agent Raincoat System.
Ooh.
Oh, okay.
And it's supposed to give some extra moisturization
Okay.
and extra protection. And so it's like let's see. So this is a cream, and then this is like a serum. And then you mix them together
Cool.
and you put it in your hair. And
Oh, you're
then
like
this
cocktail it
is,
in your hand?
uh-huh.
Oh, okay. That's
And
a
then
good
you
tip.
just start at the ends and then move your way up. Just the same thing as like with an oil that you
Okay.
use to shine and smooth your hair. And then I also tried to do some scalp care.
Oh, yeah. Scalp
Oh.
care is so important. We've talked about scalp care on our website in a past podcast
Oh, yeah.
episode, I think. It's like people don't think, I think not a lot of people think, oh my gosh, like dermatologists talk about this. It's like your scalp is part of your skin and it's important to take care of it and like detox it. And I see it, you have a scalp massager thing, right? Or
Yes. So
yeah.
this is what I use. So I just put this in like this.
Okay.
And you do that everywhere. And then I just take this and
You
you go like this.
Oh.
And you just exfoliate it in your hair. And it's just really good to help your hair grow.
Okay.
And it's also is supposed to help the hair follicle to be healthier, if that makes sense.
Okay.
Yeah.
That makes
Yeah.
total. Yeah, I totally.
Did you know that redheads have thicker hair strands?
Yes.
And
We
that's why
do.
we normally have thicker. I'm sure you did, but I think that's a fun one. Everybody's always like, your hair's so thick. And I'm like, I know. And then I learned why. And it's because the hair follicle is thicker than other.
Yeah.
Yeah, then blondes and
hair.
brunettes. Redheads have I think we have more strands too, if I remember right. Like we have more
Yes.
strands, which makes it thicker.
Yep.
Yeah.
Because each strand is thicker than a natural blonde or brunette. So that is
Which
a
is so
really fun
interesting.
fact. I know. It
Yeah.
really is so
Yeah.
interesting.
We're just an interesting group.
Yeah.
We're rare and unique, and we're not going extinct.
Nope. We're not going extinct. That is wrong.
Yeah. I did want to ask one final question about
Yes.
going back to teeth. Do you ever, when you are in an office and you see a redhead, whether it's a patient or a colleague, or maybe it's a traveling hygienist, I don't know if they have that in your practice. Do you ever look at each other? Because redheads, we say it's like a secret club.
Yeah.
Yeah.
Well, I always say something about them having red hair. It's so fun. I love to see redheads actually. Because
Yeah.
it just makes me feel I don't see redheads very often, and so it just makes me feel like, oh yay, one of my kind.
Yeah.
They
So
understand me.
there's not a lot of redheads in Idaho Falls.
Well, there is, but I'm just saying at my dental practice.
Oh yeah. Yeah.
I don't see a whole lot of redheads just in that kind of vicinity of my life. But there is a lot of, like, in the ward I grew up, there was a family that had 10 kids and like 8 of them had red hair.
Wow.
And
Wow.
so oftentimes where I go, I do see a lot of redheads. It's funny.
That's so cool.
I know, and you
But
do
for some
eye
reason
each
in the
other.
dental office, I don't see very many. Yeah,
Yeah.
I know.
It's like, oh my God, I see you, you see me. We're redheads.
Yep.
Especially when you're out with your son, Ash, who you said
I
the oldest has
know.
red hair, right? People
Yeah,
probably
I'll
are
have
like,
to send a picture of him.
Yeah, we would love
Yeah.
to see that. I know. I think there's a girl in my son's preschool and she has bright red hair. And she'll come up to me every now and then during drop off and say, your hair's pretty. And I say, your hair's pretty too. Or like, I'll say your hair, or her mom puts it in a really.
Hear it often. We didn't hear that often.
Yeah.
Didn't.
No, I make it a point. And then sometimes I
Yeah.
notice that if her hair's done like in a pretty braid or whatever, and I know as a parent how, like you have to plan your morning to get
Right.
their hair styled. So I kudos to whoever did that for her. But I always make a comment about her hairstyle and she kind of blushes and gets so excited. And then the other day my son goes, you have the same hair color as the girl in his class. And I said, yes, we're rare and unique. And it was just so cute.
And we need to lift each other up.
Yes.
You know what's also really funny? So in my family, my brother has red hair. And so me and him had a redhead, and all the grandkids that were born in that like year, they had red hair. It's so cool. So I'll send a picture.
That's
born
so
in
cool.
that
So the same
year.
year.
Yeah, same year basically. They all had red hair. So my son has red
Wow.
hair, his cousin Stella has red hair, and then he has a cousin named Brielle. She has red hair, but I'm super jealous because she has black eyebrows and black eyelashes. So hers is more auburn, but it's so pretty. And then we have one more that had red hair. I'm trying to remember because they're more strawberry blonde now.
Wow, what are the chances?
Wow.
Yeah, it was
It
so
runs
funny.
in your family.
And they're like all friends, so it's super fun.
Ash, thank you for coming on. It's been a pleasure.
Thank you for having me. It was so fun.
So much fun. Thank you so much.
Thank you. Nice to meet you.